Hey guys, welcome back to the channel, back to my YouTube space as usual. And today's topic will be about when we should exactly shift our clinic. What are the reasons behind it? Why I plan to shift my clinic? Till now it has not been shifted otherwise, but still I'm planning to because it's already been shut and there are some problems which I had already discussed in my earlier videos. So when we should shift our clinic, when do we have to plan to shift the clinic? So basically there are many reasons for that. So first of all, the first and foremost reason for shifting the clinic is when we are not getting any good OPD in our clinic. Yes, so see, there is no point in waiting for years and years waiting for the patient to come to your clinic. Some places just don't have a good vibe, and for example, we open up a clinic, we invest a lot of money in that, and we think that since we have invested so much money, why to shift this clinic to another place? Then again we will invest another some huge amount to do the interior and all. But this is not the true fact. Actually, suppose if you have, I have already discussed in my earlier videos, if your clinic is not running in the first 1000 days, 1000 days होने के बाद भी if your clinic is not running nicely, that means you can wait for one more year, max to max 4 years, and then you need to change your clinic if the patients are not coming to your clinic. If the OPD is at 2, 3 or every alternate day one patient is coming, there is no point in opening a clinic. See, why you have opened the clinic, right? To fetch some money, for some growth, so that you can buy something, or you can see in the long run, whenever you will be getting these kind of less amount of patients, you won't be having that much of money with you, and you won't be able to invest more in buying implant kits or lasers or cautery, anything which you need to invest more money, right? So it's better to, rather than cry and sit in a place for a long time, you should look for a better place. See, I have already made many videos in which I have told about how to select a good place for a dental clinic, but still I'll tell you that you should see how you should check actually. So first of all, important thing is there should be parking space, and there should be footfall of many normal patients, like people are going to the vegetable market or a temple or any kind of church or any kind of social gathering should be there near around your clinic, like an ATM or bank. So we have to choose a place like this. Okay, you may get a bigger place in a residential area, but in a residential area, the particular locality area will only come. The other outside people won't come to a particular residential area. So you should always choose a commercial or a marketplace. I know the rent is a little bit higher. It will be approximately 8 to 10,000 rupees higher than a residential place, but you will surely make that much amount of money that will be able to clear all your dues. The second thing which why I tell to shift the clinic, because suppose that depends upon your owner. Okay, if the agreement is set for particularly, for example, 10,000 rupees, and if you seeing that your owner is increasing the rent every year by a hike of 15 to 20%, so in the long run how much rent you will give? That is the very good big question mark. Like suppose you are giving 10,000, then again next year he asks for 15,000, then again he is asking for 18,000. So if he keeps on increasing the rent, how will you get the profit for you? Like how will you do things for yourself, right? And people are very lucky who are having their own clinic, own place, and in the marketplace. So nothing better than that. Having your own place, own means it's your own property. Nothing better than that. But I think 95% of the people, they are not having their own property. Dental clinics are running basically on commercial areas, and people are paying rent. So basically rent is a huge thing which we often ignore, and we often tend to invest a lot of money in a rented place, which we should not do actually. So when we are opening a clinic, we should not put a lot of money into it. Rather, we should put a lot of money in buying the instruments of the clinic, right? Suppose बहुत लोग क्या करते हैं, इंटीरियर में बहुत खर्चा कर देते हैं, but they don't buy basic things like RVG, or they don't buy simple things which is really required in the clinic. So rather concentrating on the interior and all those things, better try to buy equipments because they will be there always with you. Suppose you invest a huge amount of money in a clinic. Suppose you put tiles and all. 1 square foot of tile, one room will cost you around 25,000 rupees. But you can also manage that with, if you don't have a tile, you can put a vinyl sheet that will only cost you 10 to 15,000 rupees. So instead of putting so much money on the interior, buy equipments. That is my second thing. Third thing is that if we don't change, we are always, Indian people are there, like we always fear in our minds or our hearts ki anything if we change will be bad for us. But it's not the true thing. Whatever change we want to do in ourselves, we have to do it now, rather than wait ki I will wait for few more days and if the patient comes then I will not change. It's not like that. If you are feeling that patients are not coming to your clinic, see, you must be knowing work, right? I'm not telling that you don't know work or you're less than efficient. Many people are toppers, they know very nice work, they have very nice communication skills, but since the location of the clinic is not good, they are not able to rise in their lives. So काफी लोग ये वीडियो देख रहे होंगे और उनको ये फील हो रहा होगा अंदर से कि मैं जो बोल रहा हूँ सच बोल रहा हूँ. तो अगर कोई भी सिचुएशन इस टाइप का है आपके पास, अगर आपको अंदर से फील हो रहा है कि आपको क्लिनिक चेंज करना चाहिए, बिल्कुल चेंज कर दीजिए. ऐसा नहीं है कि आपके पेशेंट्स जो आपके पास दे आर लाइक दे यूज्ड टू कम टू योर क्लिनिक, नाउ दे वोंट बी एबल टू कम. ऐसा कुछ नहीं है. योर वर्क शुड बी गुड, यू शुड बी ऑनेस्ट टुवर्ड्स योर पेशेंट, यू शुड बी वेरी मच dedicated towards your patient and your work. Then patients will definitely come, and availability is also important. So basically this is the main reason. If the OPD is not coming, if your rent is increasing day by day, then you should better shift to a new place or buy your own place by taking loans. Rather, why I was changing my clinic, because the only reason is that clinic is very far away from my home and I was not able to give proper time to it. So patients were returning from the clinic, and it was becoming the main reason why I want to change my clinic, because I am getting a lot of tension because of that, because I'm not able to give time to myself, my family members, and it's taking a lot of time. That is the only thing, and we don't have only 24 hours in our home. So doing a full-time job plus running a very old clinic plus that clinic also, it's too hectic for me actually. So maybe you can do, but it's very difficult at one point of time after. And एक और चीज मैं आप लोग बोलना चाहूँ कि लाइक कितना काम करोगे पक जाओगे काम करते करते, यू विल गेट बर्न आउट. अभी मैंने कुछ दिन पहले एक वीडियो बनाया था, बर्न आउट इन डेंटिस्ट्री. मतलब हमारी भी कोई लाइफ है, हम लोग भी एक इंसान है, ऐसा नहीं कि हम खाली दांत ही घिसते रहेंगे. सो वी हैव टू एंजॉय अवर लाइफ, वी हैव टू स्पेंड टाइम विद आवर फ्रेंड्स, आवर फैमिली, वी हैव टू गो आउट एंड सी द वर्ल्ड. ऐसा नहीं कि अब कितने लोग जो प्रैक्टिशनर्स है शाम का टाइम तो एंजॉय नहीं करते हैं. 5 to 9 they are all in their clinics. Some people go back to at their home at 10 p.m. 10:30 p.m. That's not good for your health and not good for your mental status. You have to go early, you have to chill out with your friends, then only you will be like you will feel like working, right? ऐसा नहीं कि आप सिर्फ काम, then after few days you won't feel like doing anything. That is the only thing, and you will get depressed. So that is the only reason I want to close. अभी तक मैं close नहीं कर पाया हूँ क्योंकि मुझे कोई नया place नहीं मिला है अभी तक. As I told you, my level plus this COVID situation also, I don't want to shift here and there and go here and there. Already many people are infected nearby around me and my locality, as well as in dental college. So guys, stay safe and if you can get the booster dose, all the doctors I'm requesting, please take the booster, Covaxin or Covishield, whatever you have taken. And love you all. Please do follow him on Instagram, _Dental, and take care. Love you. Bye bye.